Well, hi, I'm Dr. Chris Cannon, the editor-in-chief of CardioSource Science and Quality, and I'm delighted to be here announcing the launch of a new clinical community on CardioSource, one devoted to cardiometabolic diseases. I'm here with Dr. Nathan Wong, who's professor and director of Heart Disease Prevention Program at the University of California, Irvine, who's the editor of this community.
Thank you very much, Dr. Cannon. It's a pleasure to be here.
Dr. Wong, cardiometabolic diseases have become more on the forefront of the discussions in cardiology in recent years. Why do you think this is, and what are the goals that you have for this clinical community for our viewers?
So clearly, in recent years, with the upsurge of the prevalence of obesity and diabetes in the U.S. and beyond, and the fact that some 3/4 of deaths in persons with diabetes are due to cardiovascular diseases, the ACC and other groups have really recognized the importance of understanding and communicating cardiometabolic issues in preventive cardiology. The convergence of diabetes and cardiovascular disease has been the basis for many such educational activities. The new ACC CardioSource community on cardiometabolic health will help to further educate clinicians on important connections between diabetes and other cardiometabolic conditions such as hypertension and dyslipidemia and the relationship to cardiovascular disease. We'll also be highlighting new strategies aimed to screen for these problems, detect those at highest risk to prioritize treatment, and newer and emerging therapies that have the potential for significant clinical benefit.
Well, what are the key components of what you have planned in this community to disseminate these key messages, as you point out, an important area? And what type of features would we expect in the community?
So our CardioSource community, which I should also note, we're fortunate to have the help of Dr. Michael Blaha, a preventive cardiologist at Johns Hopkins, who is serving as associate editor, will feature a collection of video interviews, interactive cases, hot topics, articles of the month, and also questions for our viewers. We have engage key thought leaders in the U.S. and beyond to address such topics and stories such as whether there's still a role for niacin, given the recent large-scale trials that have failed to show benefit, why the look-ahead lifestyle study in type 2 diabetes did not achieve its primary endpoint, also the role of masked hypertension in a diabetic, and the role of imaging to help identify persons most likely to benefit from preventive therapies. We'll also be discussing the role of newer and emerging lipid and anti-diabetic therapies and their potential cardiovascular effects. New clinical trials of diabetic agents recently discussed at the ESC, for example, really highlight the need to communicate the practice implications of these to the greater cardiology community.
What a terrific set of questions. This is really a lot of the conundrum that we learned from the various trials, and it looks to be terrific. I mean, what do you think will be the take-home messages for the practicing clinician out of your community?
Well, I really hope that clinicians will utilize our educational offerings to gain greater insight into how to better help patients to prevent initial or recurrent cardiovascular events by ensuring better adherence both to lifestyle management as well as to the recommended evidence-based therapies. Clearly, with 6 of the top 10 causes of death globally being cardiometabolic risk factors, including elevated blood pressure, glucose, overweight and obesity, physical inactivity, smoking, and dyslipidemia, we really need to do a better job at addressing these issues in order to really have a chance at achieving our 2020 goals for reducing cardiovascular disease by 20%. I hope that our site will help provide and empower clinicians with the information and tools they need to help us reach these targets.
Well, I want to thank you, Dr. Wong, for sharing your insights on this community. This promises to be really a vibrant community that is truly the center of a lot of the heart disease that you point out, and we hope that this will be helpful to all the viewers on CardioSource. So thank you.
So thank you again, Dr. Cannon, and we look forward to helping with this exciting new clinical community for CardioSource.